So you mentioned that blurry vision can be one of the symptoms of diabetes. So following that, we do have a question from our viewers. He says diabetes over time usually affects vision. So is there any assistive care for that?
So at least here in US, we mandate people that whoever has diabetes should be seeing an ophthalmologist, an eye doctor once a year, because there can be some very serious complications of type 2 diabetes. If unmanaged, that can affect the eye. It's not just the lens and cataracts, but it can actually lead to bleeding in the eyes. And you may need laser treatments to prevent that. So as a rule, if you are a diabetic, once a year, you should go and get your eyes checked. Make sure they do dilate. I'm not talking about prescriptions. I'm not talking about your glasses. I'm talking about inside your eye. So the back side of your eye, the retina, that's what needs to be checked. So make sure once a year you go, they should dilate your eyes and look inside your eyes. Nowadays, there are machines which will do that without dilation too. I'm not sure if they are as prevalent in India, but they should be. I mean, they are pretty standardized where you don't have to dilate. So, you don't, because, it becomes hard to drive and all that after dilation. But there are machines that can capture the bleeding and what is going on in the retina.
Okay. So you said once a year, if someone is diabetic, he or she should go and check the eye with the eye doctor.
Just as a norm, but if you have complications already starting, your doctor themselves will tell you come back in 3 months or 6 months. If they are monitoring something, if they are worried about something, they will themselves tell you. But just as a guideline, once a year, assuming everything is okay, you should go and see.
Okay. But then how often does a person with diabetes should visit the endocrinologist?
Sorry, what did you say? I'm sorry, you were cutting off.
How often does a person with diabetes should check with their endocrinologist?
So at least that's also, I mean, I know that in India, people don't go unless something starts happening. Here, we ask people to come every 3 months. If they are doing fantastic, nothing is going on, their A1C, hemoglobin A1C is a marker of diabetes, how you are doing. So it's a marker for 3 months, and we check that every 3 months. If everything is great, my patients are stable, I have some patients over long term that nothing has changed. I see them every 6 months, maybe. I don't think I have anybody who I see once a year, because 1 year is a long, long time. But if your A1C, hemoglobin A1C is beyond 7, you should be seen every 3 months, because that is not controlled. Now, let me touch base on the hemoglobin A1C. I know you haven't asked me yet, but let me just, since I mentioned that, let me just tell you. So hemoglobin A1C is a marker in your blood that should be checked every 3 months, which tells you and gives you an idea how your blood sugars have been controlled over the past 3 months. What it is, it's sugar attached to your red blood cell, and your red blood cell has a lifespan of 3 months in the body. So your blood gets replenished every 3 months, and that's how you will get an idea how your sugars are for the past 3 months. And that hemoglobin A1C should be less than 7 for sure, if possible, even less than 6.5. That would be the normal range. And depending on the blood, again, lab, it may change a little bit what their normal is, but the gold standard would be this. A normal person, just to give you a perspective, has a hemoglobin A1C of less than 5.6%. But for a diabetic, we don't necessarily aim for 5.6 or not even less than 6, because if you try to go that low, many a times people will end up having low sugars, which is also not good for them, which by itself can be dangerous.
So now that we know how often someone should check with their endocrinologist, don't worry and start searching for one. Just visit www.eglobaldoctors.com and you'll find the best expert doctors from India, US, and other parts of the world just at your fingertips. So coming to our next question, which is commonly asked from women, is that can your menstrual cycle or going through menopause affect glucose levels?
It potentially can, yes. There are a lot of hormonal changes that happen during a menstrual cycle, the hormones being estrogen and progesterone. And also after menopause, women's body goes through like a new change. Women's body goes through like change 3 times. Once first stage is when they are born, then puberty hits, and then menopause hits. So there are 3 stages in a woman's life that things do change. So yeah, potentially it can, but not to the extent that people would think. There are, in literature, it has been mentioned that it may increase insulin resistance, which may lead to some high sugar levels, and your sugars may fluctuate a little more during that period of time. Again, if you're aware of it, if you do diagnose that, hey, looks like I am a person like that, where the sugars go up and down, just be careful during those 3-4 days, try to avoid carbohydrates. But the fluctuation is not to the extent that it's going to go up by 100 points or something. If at all, it's going to be very minimum. There's not much data to tell you either way. But yes, potentially your hormones can affect your blood sugars.
Right. While mentioning about the type 1 diabetes, you said that the insulin is mandatory in that type, and if not taken, there can be complications. So what exactly are the complications of the diabetes?
So the one with type 1 that I mentioned is a very serious one. As I said, you can die from it. That's diabetic ketoacidosis. We won't go into that much in detail because that's rare. Most people won't even know about this because that doesn't happen that commonly. But more commonly, what happens with type 2 diabetes, if not controlled over years, is that it can lead to, it's a slow killer. So, cancer and all or heart attack has a lot of glamour, but because it can, lead to death. But so does diabetes. It's a very slow killer. And people don't realize that because things are happening in the background slowly. If your diabetes is not controlled beyond 7A1C, that graph of complications exponentially goes up. So it can lead to blindness. As I said before, it can lead to bleeding in the retina, which may lead to blindness. It can lead to kidney complications. People end up on dialysis. Of course, it can lead to heart attack and stroke. So that's what we call macrovascular complications. So we divide that into macro and micro. But again, for laymen, we won't go into details of that. But bottom line, you can lose your eyesight, you can lose your kidneys, be on dialysis, you can have a heart attack and stroke and die from that. You can have complications of nerves. So it's something called neuropathy, meaning your feet may not feel the same way. People may be walking and they don't feel that they're walking, and they may fall. They may feel like they're walking on cotton, or sometimes it can be painful. It's like needles stinging in their feet. These are all extreme cases, but that does happen. It's not like people always think that, oh, it's not going to happen to me. But over a period of time with uncontrolled diabetes, that surely can happen. And then there's no going back. Once the complications start, there is no going back. Once the kidneys start failing, then you cannot wake up and say, okay, let me control my diabetes, my kidneys will get better. Then it's already too late. There are kidney transplants and all that, but why even go to that extent? There's also circulatory problems, so people may end up with ulcers because their circulation to their feet is not enough, because of diabetes. Just like your heart has circulation, your feet has circulation, and if that suffers, that can lead to ulcers on the feet. And because of diabetes, sugar is a good medium for bacteria. So it invites bacteria and fungus and virus and all that. So infections are very common in uncontrolled diabetes. So imagine the ulcer gets infected. Next thing you know, people's limbs can get amputated. Doctors will try to salvage that, but sometimes it's beyond that and you may need an amputation.
So what should someone do to avoid these complications?
Keep your diabetes in check. So make sure you're seeing your doctors, make sure you're checking your sugars. Again, something that we didn't touch base on is checking the blood sugars. At least here, people who are uncontrolled, we tell them to check their sugars 3 to 4 times a day. And we will give them guidelines, as I told you before, fasting sugar. In a diabetic, we tell them to keep it below 120, and then 2 hours after a meal, less than 140. And so check your sugars. People blindly will say, oh, no, I eat well. I didn't eat much. Well, how do you know? Unless you check your sugar, you will never know. Was that a good idea or was that not? The common misconception is fruit. As I said, people think fruit is natural sugar and they go for it. And well, check your sugar. If 2 hours after a meal, if you were 200, guess what? That fruit was not good for you. So check your sugar, keep your blood sugars in check, keep that A1C below 7. And that's the best way of making sure that you won't have complications.
That was my very next question. Like, how many times should one check their blood sugar level? Thank you so much.
Yeah, so and it also depends on how uncontrolled or how severe your case is. Someone who is on 4 shots of insulin, they have to check their sugars 4 times a day, because otherwise it's like shooting in the dark. If you're taking short-acting insulin and you don't know what your sugar is, you may overshoot or you may undershoot. So, if you may take 10 units, let's say, and you never checked your sugar, how do you know whether that was enough or not? So you have to check your sugar, especially if you're on insulin. If you are well controlled, decently controlled, maybe you can back off. You don't have to be as aggressive. And your doctor will again tell you on that part that, sometimes I tell people, hey, you know what, your A1C has been 6.5 or 6.2 for so many years. It's fine. You can check it 2-3 times a week, maybe, or not even. It again depends on how motivated the patient is and how they have done over the years. There are now good devices and something called continuous glucose monitor. It is very, very commonly used, at least in the US. I think it has started to come a lot in India as well. Common brand is Freestyle Libre, and that's commonly used. There is also Dexcom, but I don't think that's as prevalent in India, but Libre is very commonly used nowadays. So do ask your doctor about it, and that you don't even have to prick your finger. You just wear something on your sleeve, on your arm, and that checks your sugar, and it can send data. If you have a smartphone, it can send data to your phone, and you can literally look at your blood sugars on the phone, and you can dose your insulin based on that. I think that is probably the best innovation that has happened to diabetes over probably the lifetime, because whoever is a diabetic knows that, how much they struggle to poke their fingers to check the sugars. So, this innovation is really, really very good. Price is, of course, an issue, and hopefully that will come down as days go by. But do talk to your doctor about that.
Wow, that is great. So we did talk about the symptoms, how to check the blood sugar levels, but I wanted to know, like, if someone is just diagnosed with the diabetes, like, can you shed some light on the diabetes management particularly?
So, metformin is a very commonly used drug. It is still the first line of treatment. It's been around for many, many decades. And majority of the people get started with metformin first. There are lots of, again, newer diabetes medicines that are on the market, and they are, again, very commonly used in US, but they're very expensive, even in US, but here there is insurance system. So, many a times, but sometimes the insurance may not pay also. So it just depends. But there are other medicines, something called GLP-1 analog, which is an injectable, and nowadays there is a pill also. So this is something that helps your body make your own insulin. It's an injectable, but it's once a week. There is another brand called Victoza, which is old, which is once a day. But again, we don't use that as much anymore because there are better ones which are once a week. These are still, I think, very expensive in India, so not as commonly used. But they help you also reduce your weight because they help you eat less. They make you feel full early on. So very helpful medicine. And it's not insulin. It's injectable, but it's not insulin. There is another class of medicine called SGLT2 stimulators. What that means is that you spill the sugar through your urine and try to eliminate that through your kidneys and your urine. So everybody, all of us spill some amount of sugar, and there's a threshold beyond which you start spilling more. So basically what this does is it changes that threshold. So you are spill the sugar through the kidneys, and that's how your blood sugar will be lowered. And these are also good medicines. And nowadays, these newer kinds of medicines also have good data that they will protect the heart, meaning people will live longer on it will not have or not die of heart attacks and things like that. So some of the commonly known are dapagliflozin or something ending in zin, just for remembering purposes. So again, talk to your doctors about that. And then very commonly used medicines are sulfonylureas like glipizide, glimepiride. I'm not sure what the exact names are in India, but these are the ones that need to be taken with meals. They are now getting a little old-fashioned. We don't use that, at least here, as much, but they are very cheap. So I think they are still commonly used. I mean, we use here as well when, again, insurance doesn't pay for things, but they are commonly used in India even now. And then once you fail all of this, then there is a need to add insulin. So sometimes you may have to add insulin. Majority of the people will start with just one long-acting insulin. A commonly known brand would be Lantus, and there are several now in the market as well, several more. And then if that is also not enough, sugars still go up after meals, then you will start a short-acting insulin, and then you're on 4 shots of insulin. So there is a progression. I mean, one doesn't come to 4 shots of insulin overnight. I mean, generally your doctor will keep adding medicines and, try to manage that, talk to you about diet and all that. But eventually, if it's not controlled, that you will be on 4 shots of insulin.
Thank you very much for the detailed answer on the diabetes management. So coming to our last question, that is the highlight and the most frequently asked question. Can diabetes be reversed or can it be treated completely?
So yeah, this is, when people get diagnosed with it, that's generally the first question, because generally people get depressed with the diagnosis. And so this, remember that this change in the beta cells are the cells in pancreas that make insulin. So, and again, I'm talking strictly about type 2 diabetes. So all these changes in the pancreas started long time back, many years ago, before even the diabetes was diagnosed. So there is no cure as such. Can you reverse it? Probably a better answer to that question is yes, you can reverse it to some extent. If you, again, behave, if you diet, exercise, lose the weight, there is a good chance that you would be diet controlled diabetic, meaning you're not needing any medicine, but you have to keep your diet in check. You have to keep your weight in check. You gain the weight back, it's going to come back. So it's just like, imagine an iceberg. You melt the water away, you see the ice, you fill it up with water, you don't see the iceberg, but that doesn't mean that the iceberg has gone away. That problem is still there. Once you melt the water, then it's going to come to the surface. So it's the same thing. You change, you go back to your old lifestyle, you start eating bad, you don't exercise, you gain the weight back, it's going to come back. So the better answer to that would be you can reverse it to some extent with diet and exercise, but you have to stick to your lifestyle changes.
So keeping up with a healthy lifestyle is the key finally, sir.
That is the key, yes.
Right. So with that, we'll be wrapping up today's FP Live session. Thank you so much, Dr. Veena, for walking us through this very important topic and informing us about all we need to take care when it comes to diabetes. I'm sure everyone watching us will be full of information right now. It will be of great help to everyone listening to us right now. Thank you so much.
Thank you. Thank you so much for this platform. I really enjoyed it. I really enjoyed chatting about diabetes, something that I do for a living. So I was happy to have this platform to share the same thoughts. Thank you so much.